No matter how you measure sympathetic nervous system activity in fibromyalgia, it is abnormal. There is one way we can do that that does not involve any fancy electrodes or heart monitors. We can actually just ask people about their symptoms. Crazy concept, but we can do this scientifically by using a standardized questionnaire that assesses autonomic symptoms. In fibromyalgia, the sympathetic branch of the autonomic nervous system is hyperactive. This negatively impacts many bodily functions, including blood pressure, digestion, urination, temperature regulation. The sympathetic nervous system is so hyperactive in fibromyalgia that it's actually, in my opinion, that abnormality that causes or triggers a chain reaction that ultimately leads to all the symptoms of fibromyalgia: the fatigue, brain fog, and widespread pain. Hi, I'm Dr. Ginevra. I'm a physician. I have fibromyalgia myself, and I have dedicated my career to figuring out this incredibly frustrating illness. I share my findings with you here in my book, The FibroManual, and in my research library. So the evaluation of autonomic nervous system function in clinical practice is actually a little bit challenging. Traditional assessments like heart rate variability that I cover in other videos and posts, those are good, and they've definitely identified altered autonomic profiles in fibromyalgia where they see that people have increased sympathetic activity and decreased parasympathetic activity based on the heart rate. However, heart rate variability measurements can be influenced by lots of different factors like physical activity and breathing patterns and medication use. So as an alternative, researchers at the Mayo Clinic developed a questionnaire that in a standardized way assesses levels of autonomic dysfunction based on those symptoms. And this is called the Composite Autonomic Symptom Score, or COMPASS 31. This is a comprehensive questionnaire. It's 31 items, self-administered, and designed to evaluate the level of symptoms of particular autonomic problems across 6 different weighted domains. So you can see here, I've listed those. So the first is they ask questions about orthostatic intolerance, and that really assesses dizziness, lightheadedness, even fainting episodes upon standing. Vasomotor dysfunction, which is more temperature regulation and sweating issues. Secretomotor dysfunction, which means dry eyes, dry mouth. Gastrointestinal dysfunction, symptoms like bloating and nausea, constipation, early satiety or fullness. Bladder dysfunction, urinary urgency, frequency, and incontinence. And then finally, the pupillomotor dysfunction, which examines visual disturbances, which is something people don't often think about with fibromyalgia. But this can involve difficulty adjusting to light, sensitivity to light, and difficulty focusing your eyes. So as you can imagine, based on these topics, this survey is super useful to evaluate fibromyalgia symptoms that are not pain-related. You can take it yourself, if you'd like, at my research library at fibroresearch.org. And the survey says, no surprise, women with fibromyalgia scored much higher on the COMPASS 31 questionnaire compared to healthy controls. Several studies have shown those results, and in particular, a 2025 study compared the autonomic survey results from 77 women with fibromyalgia to 77 women without fibromyalgia. Out of those 77 women, 65% of them had high scores on this survey, meaning they had problems in those symptom areas. This was compared to only 3.5% of healthy controls. And they actually found that across all those different 6 symptom domains, across all of them, the fibromyalgia patients consistently reported higher symptom burdens. But there was one area where fibromyalgia patients tended to do the worst, and that was orthostatic intolerance, or symptoms when standing up. This was one of the most pronounced areas of dysfunction, and they noted scores that were substantially higher compared to controls. This aligns with what I see in my clinical practice and also what I've experienced in my own life, where problems with standing up, lightheadedness, or low blood pressure issues in general tend to be really common in fibromyalgia. So this study took it one step further, where they compared the scores on the Autonomic survey test to a different survey, and this one evaluated the severity of fibromyalgia symptoms and how much fibromyalgia was impacting people's lives. This study is called the Fibromyalgia Impact Questionnaire Revised, FIQR. So those fibromyalgia subjects who described more problems with their autonomic nervous system also had more severe fibromyalgia symptoms and disability. So to sum up, people with fibromyalgia have more problems related to sympathetic nervous system dysfunction when assessed by a symptom questionnaire. You can find that questionnaire and more in-depth coverage of this topic, including references, at fibroresearch.org. There you can also join my mailing list to be kept updated on new research as it comes out. For treatment information, head to my book, The FibroManual, which was just released in an audiobook form, which I'm very excited about. I hope this information is helpful in your journey to understand fibromyalgia. Thank you for watching.